Dear friends, my best wishes to you all on the International Women's Day, which is falling on the 8th March, a few days later. And the theme for this year's Women's Day is, of course, accelerate action. And we know that action is needed in all areas for women. I'd also like to remind you at this stage that heart disease in women has been ignored for a long time. Do you all realize that we used to think, and the myth has been in the past, that women are less prone to heart disease, and most of the focus of prevention of heart disease, of treatment of heart disease in the past have been for men. But I must also tell you that women, the number one leading cause of death in women is also heart disease and coronary artery disease. 6 times more common than breast cancers. In fact, commoner than all cancers put together. 18% of the deaths in women are due to heart disease. The risk factors of heart disease in women are the same as men. We talk about obesity, hypertension, high blood pressure, diabetes, high cholesterol levels, lack of exercise, and of course, smoking in low socioeconomic groups, tobacco chewing. All these are important risk factors, including family history and stress. But we must also remember that these risk factors cause more harm in women than in men, much related to the size of the artery, the size of the body size. And that is why women respond less favorably to the risk factors. And it is important for women to take care of the risk factors, even to a greater extent, so that they don't have coronary artery disease. What is also important to understand is that the symptoms of heart disease, the heart attacks, are very different in men. While most men may complain of severe chest discomfort, which is easily understandable, going down the arm during walks, etc., in women it can just be ghabrahat. It can be breathlessness, it can be sweating, nausea, vomiting, atypical symptoms. It's also been noticed that women tend to ignore themselves and of course give priority to their family first, put themselves last. And that is one of the most important reasons why they do not get health checkups done regularly. The disease is often advanced when they go for a diagnosis, and their response to treatment, it has been noticed, has also been very poor. Therefore, it is very important for women now to wake up and look after themselves. In fact, the health of the family and the health of the nation also revolves around health of the women in this country. So do look after yourselves, have regular checkups done, give priority to your own health, and make sure that any disease process is prevented or diagnosed early and taken care of timely, so that best outcomes can be achieved and we can decrease this scourge of coronary artery disease even in women. It's grown 300% over the last 15 years. We must ensure that for women, earlier help is needed, earlier attention is needed, and that women do take care of their symptoms and reach hospital or doctors earlier and faster, so that treatment can be instituted at the right time. There's also another aspect which our women suffer from. Lack of activity, therefore leading to obesity, and that has increased immensely over the last 15 to 20 years. And the other aspect is stress. There's a greater stress on women than in men, related to a number of factors. It could be factors at home, socio-economic factors, the responsibility of a family to be taken care of, the responsibilities of all other relatives to be taken care of, and then there's the work stress, and of course the mismatch, and other aspects at work. And therefore, it also becomes very important for stress relief, for stress management as a part of preventing heart disease in women. So all in all, I think it's called for action from all spheres. We have to prevent heart disease in women. We have to prevent the biggest killer, which is heart disease in women. And we must take early action and empower women to understand that coronary artery disease is the most important killer even in women, and that early help, early attention to symptoms, early diagnosis, and early attention to treatment can decrease the effect of heart disease in women. In the same breath, I must urge the male family members also to be responsible towards women towards the ladies in the house and to ensure that ladies are taken for regular checkups, for diagnosis, and for treatment, just as they would do it for themselves or any other member of the family. So giving priority to ladies is a responsibility of all men in the family.